centuries of racism have impacted our communities of color with respect to outcomes and survival from cancer. How can we spread knowledge on racism and oncology? At the institutional level, we can focus on education and training. We can do research into what's happening and research into what works. And it's very important that this start at the leadership level. If the leaders have not bought into it and aren't promoting it, it will not permeate across the institution and it will not work. At the individual healthcare provider level, we can support our institutional's initiatives. We can not just take implicit bias training, but understand culture and differences and practice with a focus on patient-centered care, where we're bringing care and adapting it to the individual patient. We can promote advocacy of laws at our state or our national level that overcome some of the barriers to care that persons of color experience. Things like Medicaid expansion and anti-discrimination measures. At the patient level, we can speak up, and I know that that can be really hard, but unless you provide feedback, and that can even be done in an anonymous way, then how are providers and institutions going to know what you're experiencing and what's happening and begin to address it? At the community level, we can promote education and awareness. Groups like Sierra Sisters, for example, hold community events where we go out and we talk about what you can do to reduce your risk of cancer or to catch it early. And the community can engage with the patients as well as the providers and the institutions in order to better collaborate and get better outcome and address the racism that is embedded in our healthcare system. It's not going to go away quickly, but it's important to work together to try to dismantle the inequities, the barriers to care, the decades and decades of discrimination, so that everyone can have access to high quality cancer prevention, screening, treatment, survivorship, and palliative care across the spectrum. It's going to take a concerted effort, and it is only ethical and fair that we work to achieve this for everyone.